Nursing Care of Eating Disorders. Module 5, Therapeutic Communication and Behavior Change. One of the biggest misconceptions in healthcare is that education changes behavior. It doesn't. Patients with eating disorders already know what they should do, but they still feel stuck. Your role is not just to educate, your role is to guide behavior change. Eating disorders are not about lack of knowledge, they are about emotion, coping, and reinforcement. If you don't address those, nothing changes. Acceptance and commitment therapy focuses on psychological flexibility, the ability to feel discomfort and still take action. This means helping patients do difficult things, like eating, even when anxiety is present. Not every thought is a fact. I feel fat becomes I'm having the thought that I feel fat. Behavior change becomes meaningful when it's connected to values, not weight, not appearance, values. For example, I want to be present for my family becomes the reason to eat, even when it feels uncomfortable. Patients move through stages of change, and your approach must match where they are. If a patient is not ready, you don't push action. You explore ambivalence. Motivational interviewing helps patients find their own reasons to change instead of being told what to do. What worries you about your eating? What would your life look like without this? You are guiding, not directing. Shame fuels eating disorders. If you use judgment, you reinforce the behavior. Instead of, why did you binge? You say, help me understand what was happening before that. This is not who the patient is. This is something they are experiencing. Families are not the cause of eating disorders, but they can be part of recovery. Teach families to support, not control, to stay present, not reactive. Behavior change happens when patients feel safe, understood, and connected to something that matters. Your words matter. Your approach matters, because how you communicate can either reinforce the disorder or help break the cycle. When you approach eating disorders, think, assess, understand, intervene, and support. These are not just eating behaviors. These are patients trying to cope the only way they know how, and your role is to help them find a better way.